And I saw
Right?
your glasses on too. Woo, woo.
No, that's only so I can see.
All righty, so we are going to begin recording now. I'd like
Okay.
to welcome you, Blaine Bandi, CEO, Wesley Community and Health Center. Thank you so much for joining me today. I wanted to just make this very short, so that because I know you're a very busy person, and I didn't want to just engulf you with my questions and answers and things like that. So I wanted to focus on one aspect. As an adult, what is it that you can remember that transpired when you were a child that helped you to become who you are today?
So I'm not sure there's a specific incident, but I have a specific recollection of being told many times as I was growing up by parents, by teachers, by others, that I was lucky, I was fortunate, meaning to the extent I was smart or could read or could do well in school, that was a combination of perhaps work on my part, but more importantly, good fortune. Similarly, good fortune to have been born in the United States as opposed to anywhere else, meaning I forget the odds, but every day the number of people born and the percentage that end up being born in the US is about 3%. So you have a 3% chance of being born into the US and all of the freedoms and opportunities that we have here relative to anywhere else in the world. Similarly, opportunities around having both parents. I come from a two-parent household, which is also an advantage. Similarly, schools, being able to go to good schools, being able to learn without the complications of being homeless or poverty or having an ill parent. So all of those were sort of good fortunes, and the recollection is that with good fortune comes responsibility, and the responsibility to aid others, assist others who may not have had that same good fortune.
So if you were at the age of about 7 years old and they're saying to you, well, you're a lucky guy. Are you thinking you're a lucky guy at 7 years old?
The honest answer is yes. If it's repeated enough, you kind of, do you question it? Do you go, well, what does that mean? But I would say yes, to a big extent, you do feel that you have good fortune, because good fortune is probably not the same word, but you're able to see others and see how you might be different. Again, I had the advantage of being in school and having the advantage of skipping a grade. I know that was not typical of my peers, and I know that wasn't anything that was attributable to me. I mean, that's just sort of happenstance. I was born with that, and so that's what I mean by it. You kind of recognize that a great part of what we do, of what we have in life, comes from opportunities, and opportunities that maybe not everyone has. And those opportunities can help define you. And again, that goes back to my belief that I owe it to others to try and give everyone else those same opportunities for success.
The reason why I was asking you that question, and I decided to come in through the adult door as opposed to coming in through the after school program door, was because I honestly believe that the foundation that people stand upon are the formative years. And that's 0 through 7 or 9, depending on what your background is.
Sure.
All right. So for you to be able to have that feeling and for it to walk with you throughout life to the point where you were able to accomplish whatever your heart's desire, that is the fortune. Because sometimes there are those that are born within a family and they might not have that type of opportunity. They might not hear that.
Absolutely. Absolutely. And that's not to suggest that only success can only be born of good fortune. It is a combination of hard work and good fortune and all things together. And that's why, I go back to an expression I remember hearing as a child, not a 7-year-old per se, but certainly older by high school, to those that much is given, much is expected. And there's a certain expectation that if you're successful, and that doesn't necessarily mean financially, it just means successful. There's an obligation that you assist others in reaching their success as well, reaching their meeting their opportunities and meeting what they can achieve in life as well.
So on that note, I'd like you to share with me a little bit about your community center and your health center. Sure. Because you're in an interesting neighborhood, community on the West Side.
We are without a doubt. So while we have two locations, this particular one I'm at now and the larger of the two is in Maryville. We're at 39th Avenue in McDowell. It is I think all would recognize a challenge community. Low income, low employment, low rates of insurance, challenges around education. Certainly there's a fair number of people who are here with not fully documented status in terms of their immigration. So all of that combines to make it a challenging neighborhood to assist in terms of services. What we provide, both with the health center, the community center, the after-school program, is we refer to our business as being in the barrier-busting business. That's our role in life.
Oh, that's different.
Because there's a concept out there called social determinants of health, whereby you can ask someone 5, 10 questions, and based on the answers to those questions, determine almost with very good accuracy what their life history will be, what their lifespan will be, whether or not they'll be subject to serious illnesses and diseases, debilitating illnesses. So that more so even than genetics, whether or not you speak English, whether or not you have a job, whether or not you have insurance, whether or not you have a house, will have a greater impact on your health and on your wellness going forward than many other things, even genetics. So those social determinants of health are what we're trying to address, and similarly provide the best opportunity for people to be successful in life. So by barriers, it's everything from financial. Can we do things on a sliding fee scale? Can we offer services cheaper than someone else so that they are available to the community? Hours or days of the week. Can our hours be flexed or adjusted so that we're an easier access point for people who may have work or may have work that doesn't give them sick time? You know, we all assume all of us work at jobs where sick time is prevalent. And in many jobs it is. There's still many where it isn't, where if you're sick, you pay twice, meaning you don't get paid to be at work and you have to pay to go to the doctor. And all too often, that means people delay seeking care until they can no longer function. And that's the worst possible time to get care. You want to try and address illnesses or injuries early, not late. Similarly, with the children, we have to provide services that can be affordable to the parents. So our cost for a week of childcare, after school care, is $15. That's for a week. If we raise it much above that, we see that our number of students goes down. But I'm sure it comes as no surprise to you that I can't pay. It costs me much more than $15 a week to provide services. So we are always faced with filling that gap. What's the gap between what our families can pay and what it costs us to provide the service?
So in the ideal scenario, and there was a magic wand that was involved, would this money be relegated to you from the state, or would it be coming from the feds, or is it going to come from locally?
Again, based on the premise of your question, where I get a magic wand and I get to pick.
Exactly.
and you will assure me that it will come from that.
Oh,
I would much prefer it be private, because there are less strings attached. There are less reporting requirements, less other requirements that may make it more complicated. So let me give you an example. One of the examples is there's a particularly among people who may be undocumented in terms of status, there's a whole discussion now around public charge and whether these folks that are here undocumented are becoming a public charge, whether someone, the government is supporting them and thereby encouraging them to leave third world countries and move to the US. And once they're here, they become dependent on us. Perfectly legitimate discussion, but that fails to recognize the fact that the kids are here, the kids are US citizens. Denying them after school programs just puts them out on the streets. That doesn't do anyone any good. It doesn't help reduce the number of people who may be immigrating without documentation status. On the healthcare side, denying people access to primary care based on that doesn't help us from a public health standpoint. You know, we could end up talking 20 minutes just about immunization, and I don't want to get there, but denying people immunizations because of their documentation status hurts us all from a public health status as well. So all of those are reasons why it's easier to deal with funds that would come from a private sector because we have more flexibility in terms of how we're able to utilize the funds, who they go to, and what we can do. Having said that, just so I don't appear ungrateful, I would also gladly take state and federal funds should they be, and I will learn to work with whatever restrictions are put on me.
In closing, because I promised you 20 minutes and time flies when you're having fun in this world. Just share with me something besides what you just said. Where do you see your strength in the community? The strength that you have in the community, where is it? Is it on the health side of the fence or is it on the community center side?
I hope it's both. And here's what I mean by that. The two are integrally tied together in that both are designed to improve the wellness broadly defined of the community, meaning we want to keep both people healthy and well, but it's more than just providing services in an exam room. One of the things we've recognized here is that our ability to deliver primary health care has got to go beyond just exam rooms, meaning if the only place we're interacting with people's wellness is in an exam room, we're missing opportunities. We need to be instructing kids in our after-school program about the importance of nutrition, of exercise, of doing well in school, of respecting their parents, of respecting their grandparents, respecting their community. All of those are important to keeping a community well, healthy, and functioning well. Similarly, the ESL programs we do, the education programs we do around nutrition and pregnancy, all of those are designed, as I said earlier, to break down barriers that may be out there in the community and help the community itself recognize its best possible outcome. And that's what I hope our strengths are. I hope we're doing a good job. I know we try daily to do it. And as I often tell my staff, it's a successful day when we drive home saying we've made a difference today. And more often than not, we're able to say that.
That's a very positive thing. That's a very positive thing. So what I'd like you to do is, what is your contact information? Just in case somebody listening to this might say, hey, listen, I live somewhere near there. Now, what was the address? And do you have a website? Yeah, talk to me.
So the couple of things. They can reach me. So my email address is bbandy@wccphx.net. I'm assuming you will be able to print that out.
Yes, I will. Okay, what an assumption. Hey.
So that I won't have to repeat it very slowly for everyone. And our web address is also wccphx.net.
Outstanding.
And we welcome, let me also give you the address, which I'm sure you can provide as well. That is 1625 North 39th Avenue. We're essentially at the corner of 39th Avenue and McDowell. As you know, we welcome visitors. I'm happy to take people around, show them what we do. We're very proud of what we do. And there's no shortage of us here wanting to say, here's what we do, here's how you can help us, here's how you can support us. And we're always open to suggestions too about new things we can be doing in the community.
And I can definitely vouch for that because that's how we met. There was a very, very warm atmosphere from your staff as well as yourself. I didn't even realize you were the CEO. So very
Sometimes I don't realize that either. So.
very nice. Well done. Well done. Thank you so much for coming by.
Thank you. I appreciate it. Look forward to talking again.
All righty.
All right. Bye.
Ciao.
Bye.